Greetings. Well, I got the word today that the Speaker's office, Teresa Lahi, is scheduling the public hearing for Bill 11236 on July 7th and July 12th. There's going to be two public hearings, plus an information hearing before that. And that is why they need as many people on Guam to stand up and say enough, protect our families, enough, please pass Bill 11236, which will do away with the Medical Arbitration Act and will help protect us and make doctors accountable when they injure or kill our family members. As it stands right now, as you may know, that there's pretty much no malpractice on Guam for you to protect your family, and there's no way you can do anything about a doctor who injures you through medical negligence unless you have $50,000, $100,000 in your pocket that you can throw away, and then still it's extremely limited in what you can do. The bottom line, though, it's not really about the money. It's about the process. This is actually Bill 11236. It's not really about malpractice, and it's not about the poor on the island. It's not about my son. It's about providing a fair process where individuals who are hurt or injured or killed through medical negligence can go through this process and bring their claim. At the same time, doctors are protected from frivolous lawsuits. That's really what Bill 11236 is. Malpractice or not malpractice? No one knows. And we don't know now when things happen because there's no process unless you're very, very, very rich and you have money to throw away on it. And most people don't. So, under the current environment for doctors, they do not have, I believe the figure is 80% of Guam doctors do not have malpractice insurance. Why should they? They got the Arbitration Act. We can't afford to take them to court. We don't have rights to go into court. And why should they have malpractice insurance? Because nobody can hold them responsible. The problem with that is that it goes much deeper. Malpractice, they say, according to research, 1% of doctors commit 32% of malpractice. This means that really a small number of doctors are involved in this, but those doctors on Guam are not identified. In other places, every place else in the country, they're identified, but they're not identified on Guam. This means that if a doctor injures or kills somebody with medical negligence, the next day they're back at work. Nobody knows. That's what the current law does. So the new bill will help identify those individuals and also will make it so that the Guam Board of Medical Examiners will stop bringing doctors to Guam who have histories of medical negligence or sexual misconduct or other things that they keep bringing to Guam, and these doctors repeat these. But we don't know if they repeat it or not because we don't know what happens because it's all hidden by the arbitration law. That's what Bill 11236 does away with. Many doctors will come back and say, oh, I'm going to leave. If this bill passes, it's going to be bad for health care on Guam. I sat there in a legislative hearing where they asked like 8 doctors, would you leave? Would you leave if the Arbitration Act was repealed? They all said they wouldn't leave. One said, well, I don't know, I may consider it if malpractice was more expensive than in the States, which it's not. So the whole idea that doctors are going to leave, I don't think so. And do you think that doctors who all are involved with these big clinics are going to say, oh, I'm going to leave? No, they're not going to. The doctors aren't going to go. But the other argument is that they make, we can't bring doctors to Guam. They're not going to want to come to Guam. So what they're saying is that doctors come to Guam now because they, one, don't have to pay for malpractice, so it's an incentive. Is that what they're saying? And 2, if they have a history of malpractice, they're not going to be held responsible on Guam. Is that what they're saying? Because that's really what happens now. The law allows doctors from other places who can't work in places that are more strict to come to Guam. So if you have a history of malpractice, come to Guam. No one will know about it. You don't have to pay malpractice insurance. Guam Board of Medical Examiners will, no problem. We'll license you because they do it often. So it won't prevent good doctors from coming to Guam because good doctors are not worried about paying for malpractice. They're coming to Guam for other reasons. It will stop doctors from coming to Guam who have a history of sexual misconduct and a history of malpractice. And right now, we know what's happening again on Guam with doctors: medical negligence, repeat performers, sexual misconduct, repeat performers allegedly. So this is where we're at right now. The doctors are all jumping up and down. They don't want this law passed. And you know, when the most affluent of the island jumps up and down and says they don't want a law passed, you need to look at how it benefits them. It doesn't benefit us. 30 years this law has been in effect. People have been silent. Doctors know the people of Guam stay silent. They don't complain. They're not going to get up into the people's faces. And if they do, it's not going to last long. That's why the Malpractice Arbitration Act needs to go. There's no reason for it. Medical negligence is the third largest killer in the country behind cardiac diseases and behind cancer. Also, it's estimated by national statistics that approximately 10 may die on Guam from medical negligence per month. We won't know it, but for sure we have more cases already here because we don't identify the doctors who do it. So a doctor can kill your child in the morning through medical negligence, go out and have his sandwich, have his coffee, and after lunch he's back at the next victim. Don't you think that you should know who those doctors are? Well, you don't. And you never will under the current law. So please, there's no reason that any doctor can justify not protecting patients. There's no reason that they can justify, no matter how much they're jumping down, how much they threaten like children. Once you hold a child accountable, they start getting upset. Just think about your own kids. Do you allow your children to do whatever they want? Or do you correct them? Or do you discipline them? Well, most of us do that. We'll correct children, make them accountable for their actions, however we do that. And if we don't do that, the child becomes out of control, becomes apathetic, arrogant, and thinks they can do anything they want anytime they want. That's a good analogy to talk about what happens when there's no accountability in the medical community. They can do whatever they want. Just like not showing up in a hospital with a dying child. They're all night making some excuse, getting some fancy lawyer to cover their butt afterwards. It doesn't matter which clinic. People listening to this, almost everyone that hears this has had some experience. Not all of it rises to medical negligence, but it doesn't have to. The law, Bill 11236, the proposed law is to give you a voice. Have you be able to say, I think this was medical negligence, and not be silenced. And if it was, and you go through the process, then fine. If it wasn't, then it protects the doctor also. And that, right now, we don't have. But everywhere else in the country has that. Guam needs to hold doctors accountable. Please support Bill 11236 and contact Speaker Therese Talahi and Senator Tello Taitagui and send them a short email and tell them, please, you're in favor of supporting Bill 11236. Because right now we're at the point, if the bill gets shot down, doesn't pass, and there's going to be, for sure, there's going to be other deaths and other medical negligence. And people are going to say, oh, we need to do something about it. But now's the time to do it. I plead with you, and I plead with you to protect your own loved ones. Support Bill 11236. Thank you so much.